Good day. Здравствуйте. Assalamu alaikum. I hope everyone is in good health. Today's topic would be the first webinar for our Gano-IRT educational series, Self-Help Guide for Recovering After COVID-19 using Gano-IRT. But there are some important messages and disclaimer that I need to put forward before I start. COVID-19 is an emerging and rapid evolving situation. The information on COVID-19 may change rapidly as new information becomes available. The information in this presentation are for informational purpose only and should not replace medical attention, especially if you are suspected or had been confirmed as COVID-19 patient. Information in this presentation are derived from the perspective of immunology, reviewing of articles from published scientific journals, and from our experience in other immune-related health conditions in using Gano-IRT methods. And also for the benefit of all, I will provide the list of literature I use in the preparation of this presentation. A preview for today's topics, I will be covering some very brief background of COVID-19, immune responses and its effect on the disease progression of COVID-19. After that, I will be covering the basics of Gano-IRT and the phases of Gano-IRT. For today, our focus are more towards what you can do for yourself after the COVID-19 incidents. If you want to know more about Gano-IRT and updated information and materials, please subscribe to our YouTube channel and Facebook. You will be notified when we have our next webinar and other material on Gano-IRT. Click that subscribe button and then the small bell icon now. Since it first emerged in December 2019, this virus that was being identified as SARS-CoV-2 spread fastly worldwide. WHO named the disease COVID-19 and subsequently declared it as a global pandemic on 11 March 2020. COVID-19 is known to readily spread from person to person. This occurs through liquid droplets by cough, sneeze, hand to mouth to eyes contact, and through contaminated hard surfaces. Close human proximity accelerates the spread of the virus. For this reason, it is recommended for social distancing of at least 1 meter apart. COVID-19 is a viral disease that typically causes flu-like symptoms. Through observations of different groups of patients, the symptoms varies amongst individuals. Symptoms generally appear within 4 to 5 days after exposure. Common symptoms including fever, altered taste of the mouth, cough, feeling lack of energy, shortness of breath, general muscle pain, and loss of appetite. There are also other signs and symptoms that involve other organs as related to how the virus spreads. If you have these signs and symptoms, get medical attention immediately. For more severe cases of COVID-19, it can lead to shortness of breath, viral pneumonia, and multiple organ system failure. Some cases even lost their life. One unique characteristic and a dangerous one for COVID-19 is that most of the infected patients do not show any symptoms but still capable of infecting others. Unlike its cousin, the 2002-2004 SARS and later the MERS virus outbreak, which both coronavirus only shown to be infectious to others after symptoms appear. This unique characteristic of COVID-19 cause problems in disease screenings. At the moment, the common and reliable diagnostic method is to use RT-PCR to detect viral genomic material, the RNA, in the nasal swab. For those with positive in RT-PCR, further diagnostic of COVID-19 is made clinically and supported with laboratory results and radiology findings. We are approaching 1 year since the first emerging of COVID-19, but to date, there are no specific treatment approved for this viral infection, although some are showing some results. Currently, according to clinicaltrial.gov, there are 4,000 plus ongoing trials in search for the treatment and vaccination for SARS-CoV-2 virus infection. Current treatment strategies are based on supportive therapy and to prevent respiratory failures as there are similarity between the other two coronavirus. For SARS and MERS, the drug used are derived from information from these two epidemics and also using in vitro observation. In the same time, scientists are also using AI in applying molecular docking in hoping to find new drugs from readily available drugs and natural compounds. In China, doctors are using TCM that was used for respiratory disease and antiviral with anti-inflammatory effects in treating COVID-19 patients and show some good results. TCM prescriptions of a multi-herbs formula was listed in the Chinese National Health Commission in the diagnosis and treatment guideline of COVID-19. To understand the relationship between immune system and COVID-19 and its clinical presentation, we need to understand how SARS-CoV-2 virus enter the cell and replicate. Similar to SARS-CoV-1 virus, the spike on the SARS-CoV-2 virus attached to the ACE2 receptor on the cell surface. You can imagine the ACE2 receptor on cell surface as the doorknob. ACE2 receptor existed in high level on cells of lungs, small intestine, kidney, and some immune cells. For SARS-CoV-2 to enter the cell, another receptor are required, TMPR SS2 receptor. Once the virus attached to ACE2 receptor, it will attract the TMPR SS2, then the virus will now enter the whole cells, the lung cells in this case, and utilize its resources in the cells for multiplication, producing new virus particles. For general virus, once the virus particles start to attach to the surface of the whole cells and entering into the whole cells, it will trigger the innate immune system to neutralize the virus particle and destroy the infected cell, stopping the virus from further infecting more healthy cells. And also inside the cells, there are also other protective mechanisms to stop the virus replication, sending out stress marker or cytokines to signal innate immune cells to destroy the infected cells. The innate immune cells responsible for antivirus are the macrophage, NK cells, and other inflammatory cells such as neutrophil. For the two SARS coronavirus 1 and 2 and the MERS coronavirus, it can avoid detection by innate immunity by delaying the triggering of type 1 interferons that are important for the signaling of macrophage and NK cells. But instead, the infected cells produce interleukin-6 and other pro-inflammatory mediators, signaling inflammatory cells to the affected area, thus causing more injury to the lung cells, as now with more cells being destroyed by the virus and the inflammatory cells, this will trigger the overreactions of other immune cells and producing more immune molecules known as cytokines to attract more and more immune cells. At this moment, this condition is known as the cytokine storm. This in fact will further cause more collateral damage to the infected area of the lungs, and the vicious cycles continue. Through experience with the previous coronavirus epidemic, the SARS and the MERS, together with data from many research on COVID-19, we can safely say that the imbalance of the host immune response that are the main factor that give rise to the dangerous properties of COVID-19. In COVID-19, the disease development are caused by low and delayed timing of innate antiviral defenses and overreactive of the pro-inflammatory responses. Therefore, the keyword here for the immunology strategy in fighting COVID-19 are: first, adequate innate immune response at early stage, balanced immune response, anti-inflammatory, T-regulatory cells, anti-ACE2 receptors. Gano Immune Reform Therapy or Gano-IRT are developed by Gano-XL. The development for the basis of Gano-IRT are based on the concept of integrative medicines and complementary medicines, where the central dogma are salutogenesis, increasing total wellness in 3P: physically, physiologically, and psychologically. As integrative and complementary medicines, Gano-IRT combine the concept and application according to oriental medicines, nutraceutical therapy, psychoneuroimmunology, and energy medicine. There are 9 principles of Gano-IRT. 1. Maintain a healthy dietary habits. 2. To avoid deficiency in micronutrient. 3. Using nutraceutical as support for the treatment of diseases. 4. Modulating immune system. 5. To remove damaged and diseased cells. 6. To detoxify the body from cells, organ, and to the system. 7. To promote the body nature self-healing process through immune modulation. 8. To restore body healthy digestive function. 9. And stress reduction. According to the 3P application, there are 3 pillars for salutogenesis for total wellness. Physically, through diet and lifestyle modification. Physiologically, through immune modulators. Psychologically, through stress reduction and promoting mental health. And external, with good environment, clean air, water, and sunshine. In terms of application in nutraceutical therapy, our central dogma are immune modulator, where more than 80% of all health conditions are directly or indirectly related to immune function, especially inflammation, as being the main cause of disease development in COVID-19. We have set up our first center for clinical application in the Uzbekistan capital city of Tashkent, which we equip with clinician and in-house laboratory. If you want to get into details and know more about the application of Gano-IRT, do subscribe to our channel and Facebook, as we are frequently conducting Gano-IRT training for both layperson and medical professional. Let's recap the keyword in immunology strategy for COVID-19. All these 5 important aspects will be covered in the 4 phases of Gano-IRT application in fighting COVID-19. These 4 phases are 1. Prevention, 2. Adjuvant therapy, 3. Recovering support, 4. Long-term regeneration support. In the first phase, prevention, I will focus on physical protections, such as wearing face masks, disinfecting surface with touch, and always keep your hand clean with washing and hand sanitizers. To keep in mind that the virus responsible for COVID-19 are spread by close contact through droplets from coughing, sneezing, and even talking. Practice social distancing of at least 1 meter apart. Do remember that COVID-19 can spread to others from a positive patient that without any symptoms. With physical protection taken care of, the next protective mechanism would be the immune system. In the preventive phases, one of the most important determining factors of the severity of COVID-19 is the timing of initial reactivity of innate immune response. For innate immune response in fighting viral attack, macrophages and NK cells are the 2 main actors taking the center stage. The adequate quick response of macrophage and NK cells will determine the severity of the disease. Ganoderma extract have been shown to be able to enhance the activity of the activation of innate immune cells, including macrophage, NK cells, and dendritic cells for the secondary immune response. According to studies conducted, the bioactive responsible for the enhancement effect of innate immune response are due to the reishi polysaccharides, their prominent composition in water-soluble extracts. Today, there are more than 200 different reishi polysaccharides with health benefit isolated from Ganoderma. with the most active being the beta-13D glucans and beta-16D glucans. Besides enhancing the innate immune response, reishi polysaccharides have many other benefits through its immunomodulating effects, including anti-cancer, hepatoprotective, reducing the blood sugar level, protecting cells against oxidation, and anti-depression-like effects. In phase 2, as adjuvant therapy, we will explore the benefit of Ganoderma extracts with other nutraceuticals as adjuvant therapy for COVID-19. Please take note that we do not claim to be able to use Gano-IRT solely in treating COVID-19. But the sad part is that there are still no confirmed drugs for treating COVID-19. However, as we all understand that the disease development of COVID-19 are caused by imbalance in immune response, information from the previous two epidemics of SARS and MERS and the successful usage of TCM in China for treating COVID-19, we are able to build a hypothesis on the rationalities in using Gano-IRT as the adjuvant therapy for COVID-19. Triterpenoids are another important component of Ganoderma in fighting viral infection besides reishi polysaccharides. Study on Ganoderma triterpenoid for anti-HIV shown that triterpenoids are able to inhibit protease substance in the virus, thus inhibiting the replication of the virus. Please take note that triterpenoids are not necessarily available in Ganoderma products, as its extraction process requires technological know-how. There are four main considerations when using Gano-IRT for adjuvant therapy. The first is its antiviral properties. Ganoderma extract have been shown to be able to fight different kinds of viruses by inhibiting the virus replication process inside the cells. One very interesting study conducted in the Chinese University of Hong Kong in 2011 using TCM on SARS found that Ganoderma are able to inhibit SARS coronavirus RNA-dependent RNA polymerase, disrupting the virus replication, slowing down the virus growth, and minimize the destructiveness of the SARS coronavirus. Together with more than 400 different types of bioactive and micronutrients in Ganoderma water-soluble extract. Ganoderma extract may be able to alleviate the symptoms of COVID-19, regulating immune cells activity through balancing the T helper cells and T regulatory cells, and reducing inflammatory mediators, especially the downregulating of the NF-kappa beta signaling, one of the pathways responsible for the devastating cytokine storm that caused the collateral damage, destroying lung tissues, causing lung scarring, and even death. In Gano-IRT adjuvant therapy, cordyceps extract are another important players for respiratory health benefits. One very important function of cordyceps extract, the main bioactive cholecystine and adenosine, helps to protect lung tissue against oxidative stress that also caused by cytokine storm and reduce the risk of fibrosis and lung scarring. Studies conducted in China Academia Sinica show that cordyceps extract inhibits the replication of dengue virus and Japanese encephalitis virus. For COVID-19 and any other viral respiratory diseases, anti-inflammatory in the lungs are very important in halting the disease. At the preparations of this presentation, 28 November 2020, there are more than 62 million cases with 1,450,141 deaths, with 42,834,102 cases recovered. Even though recovered, these recovered cases still have some impact globally, either financially, to the healthcare system, and also to the patient and his or her families. Information from previous SARS and MERS epidemic together with information from different countries especially China and Italy, have shown that the patients are affected with post-infection syndromes and also psychologically. Information from China reported by Meng et al. Show that most of the patients with no symptoms too have ground glass opacity in their CT scan, showing pneumonia as a result of tissue injury by the coronavirus. For patients with moderate and severe symptoms, lung tissue fibrosis will lead to chronic obstructive pulmonary disease (COPD). As a result of the symptoms developed, their quality of life will definitely be affected. Information from SARS also shown that some patients develop autoimmune disease and osteoporosis. As the high inflammatory response in the blood and lungs, the lower affinity of gas exchange in the lungs will also affect the brain cell, produce some neurological and psychological symptoms. Polysaccharides, adenosine, and cordycepin from Ganoderma extracts and cordyceps extracts have neurological benefits, such as the calming effect, anti-depression-like effects, anti-anxiety, and enhancing the microcirculation in the brain. Of course, the ultimate goal of Gano-IRT are salutogenesis. After recovering from COVID-19, the patient needs to modulate his or her immune system for the continuous healing process of the body. Application-wise for Gano-IRT, the timing and phase of product usage are determined by three important factors: effective immune response in preventive measure and to reduce the risk of disease development to more severity, anti-inflammation, and immune modulations for cellular repair for the healing process. For this, we'll describe the timing, product usage based on the pyramid of nutritional needs, with the base the foundation for healthy body using functional food, enhancer to enhance the level of health, and also as an enhancer for the therapeutic or adjuvant support. The timing and product usage will be shown in the following charts. For the products in the category therapeutic and adjuvant support, we are recommending Reishi Gold, made from 100% water-soluble Ganoderma extract, rich with reishi polysaccharide and terpenoids. Exilium Gold, made from the multi-phase low-temperature extraction methods from the mycelia of Ganoderma lucidum. Through the proprietary extraction process, we are able to maintain the active enzyme and peptides from the mycelia of Ganoderma lucidum. iGano capsule, the Ganoderma water extract with 20 times extraction ratio. iExcel capsule, the Ganoderma mycelia water extract with 20 times extraction ratio. Cordygold, made from 100% cordyceps water-soluble extract, rich with adenosine and cordycepin, and the clinical product, SRIGP, a double extraction product with high concentration of reishi polysaccharides and terpenoids. Enhancer, to enhance the body physiology, to elevate symptoms, and also for the removal of toxin from the body. Sakano, made from the extract of Dongkat Ali, a herb prized as the natural Viagra of Malaysia, helps improving microcirculation. iGasino, for the removing of toxin from the body and maintaining of healthy gastrointestinal tracts. iRoyal, made from royal jelly and mycelium extracts for the modulations of brain health and also to enhance the sleeping patterns. Gano tea, robust tea and Ganoderma extracts helps to improve the antioxidant level of the body and to remove toxin from the body. As for the functional food, it can be used to replace the daily beverages with a healthy one. During the adjuvant therapy stage, nutritional levels are very important. Sorbitol gold with soybean protein, seaweed calcium and vitamins and minerals, providing the foundation for healthy cellular repair. Gastrointestinal health with a healthy microbiota are very important in promoting healing, modulating the immune response, and to lower the risk of secondary infection while the body are busy fighting the coronavirus. A new product to be launched, Cool Tea Latte, are made from herbs with antipyretic benefits and reducing flames. Some of the herbs used in cool tea latte are similar to the one used in the TCM formulae used for treating COVID-19 in China. For conclusion, Gano-IRT has been used as the adjuvant therapy for many health conditions such as cancer, diabetes, cardiovascular health, fighting dengue. All this through the central dogma of immune modulation and anti-inflammatory. At the moment, almost after 1 year since the emergence of COVID-19, we have yet to have a confirmed drugs and vaccination for COVID-19. But what we know for sure is that a balanced immune response, the adequate and fast-acting innate immune response, and the adequate control of the immune response through the modulation of T helper cell Th1, Th2, Th17, and the T regulatory cells shown to be beneficial. And always remember, our healing process are depending on a balanced immune response. This is not the end, but the beginning of a Gano-IRT educational series on webinar. Subscribe to our channel and Facebook to get notification for updated information. Thank you.